the HealthTech listeners, I'm your host this week, Hayley Levine. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week we are back with Jo. Jo joined us last week and we talked a bit about effective communication, some of the ways that she communicates with her team, and we are here to continue that conversation again. Going back to kind of the message when you want it to be a clear, focused message, I mean, you've talked a lot about how to get the best, most effective communication out there. But I guess to summarise, what are your tips to giving a very, very clear message to someone or a group of people?
Yeah, I think you have to be assertive, but in a nice way. You have to be very clear about what the message is that you're wanting to give. And I think that comes down to, you have to value yourself and value your opinion or your facts. Make sure that your facts are always right. Know what you need, but also what you need the other people to understand and what you want to get out of it. Try not to express negative thoughts or negative comments, because that will always get negativity back. And learn to say no, I think, as well. To people when they're always, people push for responses and things, learn to say no, learn to say, I need to just think about that. I can't respond straight away, or that's not something I'm able to respond to. Try not to not make things up, but always make sure that it's factual. But I think it comes down to that, having that sympathy, that empathetic sort of assertion, that gets across a very strong, clear message, but in a nice way, and so that it's full of positivity, but gives a truthful picture rather than trying to flower things up to make it look better than what it really is. I think that's always my way. I think also as well, there are certain situations where you can bring humour into things, which helps to always lighten situations. It's not always appropriate, and I think people have to recognise that. And I think, you have to be willing to compromise sometimes. At the end of the day, we're all humans dealing with humans, so at some point there's going to be some disagreement. So you either have to agree to disagree or work around a compromise to get the right solution at the end of the day.
And what about confidence? How do you think, or what's your advice to someone that might not be that confident at doing those things?
Yeah, I mean, I'll be honest with you. I think it takes time and experience to build your confidence up when you're speaking to in particular groups of people. That isn't something that comes easy to everybody. It certainly isn't something that I've ever found very easy. I don't find this particularly easy, if I'm honest, and I'm just talking to you, Hayley, and I've known you for a long time. But I know that the audience it's going to reach is bigger than just you and me, and so it does take, I think, that comes with life experience. It comes with maturity, having to build up that confidence. But I think, practicing what you're going to speak. If you're speaking to a large group of people, you generally what that topic's going to be on. So practice it, stand in front of a mirror. I'm very handsy. I talk a lot with my hands all the time. And I once was I did a lot of training at one point in a job that I was doing. And one of the negative feedbacks that I got was that one person actually said that they found my hand distracting, but also they found it a little bit. They found that it was very off-putting. They didn't find it very engaging, and so from then on, I always wore uniform with pockets or trousers with pockets so that I could at least put my hands in. And I know sometimes that can give a negative thing, but then I found myself at the beginning of sessions saying, "If you see me with my hands in my pockets, it's not because I'm bored. It's because it's to stop me from going, like this all the time, So I think, having belief in what you're going to say, making sure that you've got your facts absolutely right and know your subject and know your topic. And I think then if you feel confident in what you're delivering, then you will overcome your nervousness and your fear around talking to groups of people. and just deliver your words very carefully and clearly, so that you know exactly what you want to get across and how it's going to be received. And I think always for me, it's just about summarising what you've said. So at the end of your message that you've got across, just summarise it. Just say, well, in summary, and it actually wraps it all up quite nicely, wraps up the conversation nicely.
Yeah, it's probably, and as I've kind of grown up in my career, I'm talking with my hands now, you're making me conscious of it. I'm going to sit on them now. But yeah, as I've kind of gone in my career, like confidence and being able to present and to a bunch of people has always been my worst nightmare. And whenever I tell someone this, they're always quite shocked, because the more I've done it, the easier I've found it. And it's still not easy. Like, don't get me wrong, I don't go up and think, oh, this is really easy. I'm actually presenting tomorrow to around 60 people, and I'm really nervous, and I'm like, I know what I'm saying, but I think there's an element of not necessarily learning to become confident. It's about learning to fake being confident. And how do you put a perception across that, yes, I am confident, but actually inside you're thinking, oh, what am I doing? There's all these people staring at me, and it never goes away, does it? It's just, you fake it.
No, it doesn't. It never really goes away. And, whatever you're perceiving outside, inside might be a completely different feeling, And, one of the things that I always do if I'm speaking to people is I always put my uniform on. Like today, I've put my uniform on because it's my comfort zone, having my uniform on, because that's me. I'm a nurse and I know what I'm doing when it comes to nursing. So for me, it just gives me that added bit of confidence wearing my uniform. And I know it's ridiculous, because it's, at the end of the day, it's a tunic, and I've got my slippers on underneath, but it's a tunic, but it's how it makes me feel. So, if something makes you feel confident, then that's going to portray across, isn't it? That confidence is going to come out.
Yeah, it's I mean, with the uniform, it's literally everything about the hard work that you've been throughout your life. So, it's got you to the career that you're in now. So that uniform is your success, really.
And it's my identity.
Exactly.
Yeah, it's my identity. It's who I am, what I am. So it means a lot to me, So wearing it just gives me that added bit of confidence.
Yeah, obviously I don't have a uniform or anything like that, but whenever I'm podcasting or I'm presenting, I always do my hair. So when I go to work, I just literally brush it. I'm not really bothered. But if I'm presenting, I always make sure I curl it or wave it. I mean, it's not quite the same now, but I don't know what it is, but I just feel like if my hair's done, I feel better.
Well, of course you do, and it's like with anything, isn't it? It's what makes you feel good. If it makes you feel good, then that your some of that. If you're constantly thinking about, oh, my hair's a mess, and I haven't got my lipstick on, or I haven't done this, then that will overtake your thought, your train of thought, and you will lose your focus on what you're speaking about or who you're talking to, because you're constantly thinking, oh my God, everyone's looking at my hair, or they know I've not got no lipstick on, or whatever. So it is about what makes you feel good. I was once given some really good advice. So I had some coaching years ago, and one of the things that I was always very nervous about was interviews. I was never very good at interviews in my younger days, and I had some coaching. And this lady once said to me, she said, "Well, what do you wear when you go for an interview?" And I said, "Well, it depends what it is. It could be a dress and a jacket, or a suit, or whatever." And she says, "Right, here's the tip then. When you go into your interview, take your jacket off, put it on the back of the chair, and move your chair forward." What do you mean, move your chair? 'Cause interviews, it's always like a table, isn't it, with an interview panel, and you sat somewhere in the middle of the room on your own. That's how it was years ago. It's quite informal these days. And she said, the reason you do that is because you're putting yourself in control of this interview. So you're moving that chair, you're saying to those people, this is my interview, and I want to sit a little bit closer to you, so I'm just moving my chair. And I'm taking my jacket off because actually I might look very formal now, but actually I'm quite an informal person, so I'm just taking my jacket off just to let you know that. And she said, because it will make you feel better not having a restricted jacket on and things like that. It was a really, really good tip, and I've always sort of kept that on when I've been doing things going forward.
That's quite a good tip, actually. I might take that one. Not that I've got any interviews planned. I might take that. It's interesting. But then I do quite like wearing a blazer, to be fair. So maybe it wouldn't work for me.
Yeah, I fiddle a lot. If I've got a blazer on, I fiddle a lot. Bit of a fiddler anyway. So, we're always like moving and, adjusting hair or something,
Oh, I'm terrible.
But that's, again, it comes down, I think that comes down to just, you're trying to be the best that you can. You're trying to be as confident as you can. And you're trying to, give that right message. And it's important, isn't it? Appearance is important. And that's, if it gives you confidence, being, gives you, that confidence to be able to communicate better because you feel that you are actually looking your best at the moment. So, yeah, it's good.
Yeah, when I think I was about 18 or 19, I had a job interview and I had quite a long blazer on with like long sleeves. And I was constantly messing with the sleeves. And that was part of the feedback because I didn't get the role because I was really nervous. And she said, all I could look at was your sleeves, which I think looking back, I think that's really harsh.
Yeah.
But now I always try and bring them up a bit, just so I'm not messing. It's
strange, isn't it, how things like that do always stick in your head, don't they? And it's sort of like they shape how you do things going forward, don't they? And it's those little things that you'll never forget. So it might have been a little comment from one person, but it had a big effect on you. And that's the same with any communication, isn't it? You have to have that emotional intelligence to understand the impact of words that you're going to have on somebody, because it might just be a flippant comment to you, but the way that that's portrayed by the receiver of that information, it could have a really detrimental impact on them. So, yeah.
Yeah, some good tips, really. Some things to think about. And I guess, so one thing we haven't sort of covered, you've been a partner of Radar Healthcare for quite a few years now. And I know you're always really positive whenever we've spoke. So I guess how has that partnership and that relationship kind of worked? And how has it supported you through the improvements you've been making on communication?
It's a good question. I think... we've worked together for a long time now, and Radar's been a huge part of our progression as a company in how we've done things. And I think the example that I'm going to give is around the pandemic, and we had so as healthcare, there was lots of information, lots of advice coming out from lots of different places. So put yourself into a GP practice manager's shoes, and she was getting information from the CCG, or ICB as it's called now, information from NHS England, information from the MHRA, information from us, and there was all this information coming into her inbox every day. And it was taking such a long time to sift through and realising actually that's the same, but it's slightly different, or this is completely different, this is completely new. And it was trying for them to try and fathom out which bits were right, which bits they should listen to. And so we agreed very early on that all of that information would come into one central place, i.e. to me, and we would interpret it and we'd put it out on Radar, so that when the message came out through a Radar notice, they knew that was the most up-to-date information, and that's what they read, and that's what they circulated to staff. We know that everyone was reading Radar and uses Radar quite a lot every day, but actually they were emailing it around as well, downloading it and emailing it to make sure that that message had got through to people who maybe hadn't got access for whatever reason. And that worked really well for us. So it really aided our communication during the pandemic in terms of getting very key messages out there. And because Radar is so mobile, so you don't have to be sat at your desk, you can get it on your phone, on your iPad, or wherever you are. It meant that everybody had got access to everything that they needed. So we immediately had GPs and nurses and admin staff working from home. And so for them to be able to still access all of the rich policies that they needed and all the up-to-date information was great for them. And that's how Radar really did help us keep our communication going throughout some very difficult times.
And did you get much feedback? I think we've spoken about this before, and I think, did you say something like you realised that 95% of people were reading them, or something along those lines?
Yeah, we because with the analytics, you can see how many people are reading your notices and things, and it went from being 40% to 95% of people were reading the notices because they knew they were important. And also having the high, medium and low priority thing as well meant that people could prioritise what they had to look at. And so it was a massive success for us, and not just for us, not just success for us, that's the wrong terminology really. It had a better outcome for the patient, for the staff and for the patients ultimately, because they were getting the right information at the right time that they needed to be able to deliver care. So yeah, it was really good for us, worked really well.
Great, thank you. So now we are moving on to the What the HealthTech moment. So I'm going to ask you, I guess, for your What the HealthTech moment. And what this is has anything happened to you in the healthcare world that's been weird or wonderful, or you've got a really funny story to tell?
So, oh God, this is so embarrassing. So I'm going to take you back to 1989. Okay. So I just qualified as an enrolled nurse, and I went to work in theatres because that's where my passion was, working with theatre. I worked in gynae theatre in Newcastle upon Tyne, which is where I did my training, and I hadn't been there long. And we used to do some pretty major surgery, some really complex surgery where patients were on the table for an awful long time. And one of the complications of that was that patients inevitably got deep vein thrombosis, blood clots in the legs. And it was always a problem when they were doing prophylactic this and doing that and all sorts of things, and it still wasn't working. And then a company called Hunter brought out these brand new wonderful things called floatrons, which is where they were like huge Velcro stockings that you used to wrap around somebody's leg, and you'd plug them in and they would inflate and deflate to give the impression that there was circulation going on there, and people didn't get DVTs as a result. So we thought, these are brilliant, these are going to be great. So we got a little bit of a research grant, and we brought them into theatres, and some of the consultants were a bit, oh my gosh, more equipment in there, and all the rest of it. And the guy had given us a demo, and because the electric cable, had to be stretched across the theatre floor, we made a big fuss about having, the hazard tape and those mats over it so that nobody would trip over it and everything. So come the glorious day where we had the first patient on the table, and we'd taken loads of care, and we'd wrap these things round properly, and everyone was happy. Cables weren't in the way of everybody. And it just didn't work. And the alarm was going, and the consultant that was trying to do the surgery was getting his hair off and shouting, and it was all chaotic. And then we realised, hadn't actually switched the power on, it was running on battery and alarming. And it was really embarrassing. It was really embarrassing because we'd just made such a fuss about this electric cable. I can see it now. People with the tape on the floor, and we haven't switched it on. So it was just beeping away, consultant getting his hair off, going mad. Oh gosh, it was one of those things that sticks in here, never goes away.
Like when you ring an IT consult or an IT company and say, "Oh, I've forgotten to," or they say, "Have you turned it on and off again?" And you're like, "No," and then it works. And you're like, "Oh."
Yes, of course it does. Always works. It's always that classic IT thing, isn't it? You try and switch it on and off. Yeah. It works really well. But I'll never forget that. It was a complete and utter, one of those moments where you just think, oh my God.
To be fair, I thought you were going to say I tripped over the wire and fell on a patient or something like that. So at least that didn't happen.
No. I think I've just remembered as well, Hayley, when we were talking before about tips and things about communication and stuff, I think I've just realised one of the things that we did as a result of the staff survey again about the communication thing was that we ran some very local small workshops just to ask people what it is that they wanted to get out of it, but actually it had a bigger impact. So it helped build team rapport, but also it helped us understand where the gaps were. So where were our gaps in our communication and what things were going on? And we made it a very fun, light session. It only took about 2 or 3 hours, but we did we did like Chinese whispers to show how communication messages get lost completely in translation. But that was a really successful day. So I'd completely forgotten about saying that. And it was just reminded me then when we were talking about that, about tips. And I thought, I just need to just tell you that bit as well, because it was a really valuable piece of exercise really to do that wasn't very long, but was a bit of fun as well, but made people understand where the gaps were and how to make things right.
Yeah, I can imagine that was quite fun actually, playing like Chinese whispers and stuff.
Yeah, it was good because the message that you give never ends up the same as what it is. So, yeah.
It's true though, that happens, doesn't it, when you've got to pass it through people and word spreads and it's a completely different message at the end of it.
It is, and it's like text messages as well. Like people rarely put punctuation in text messages. So when you're reading it, it's just like one long message, and when you've got a comma in the wrong place, it can make a big difference between what that message actually is. And it's like when people write in capitals. If they send you an email in capitals, I automatically think, why are you shouting at me? When really all they've done is mistakenly flips the caps lock on, they're not really shouting at you, they've just forgotten.
Yeah, it is perception, isn't it? Especially if you get like an email and they've put an exclamation mark on, or they've said something in the wrong way and you think, are they being funny with me there? I can't work it out.
Yeah, I mean, you talk about email, and I go back to, my first days of training and qualifying, and we didn't have email. The only form of communication you had was a letter or telephone. And was the communication any better or any worse? Probably the same, if I'm honest. Messages were still relayed and misinterpreted the same as what they are today. There was no real difference. It's just now we've got more ways to get it wrong or right than what we had a long time ago.
Yeah, definitely. No, that's been really insightful, and I've definitely taken a few things away actually, especially the hand. I always talk with my hands, so I've definitely got to be more conscious of that, especially in my presentation tomorrow. So, thank you so much for joining us. It's been really, really useful. I'm looking forward to sharing.
Welcome, Hayley. It's been a good conversation, and make talk for England.
It's a good thing. No, it's been great. Thank you. So next week we are going to hear from product experts Mark Fuster and Ellie Jordan at Radar Healthcare, and they're going to be chatting about our new community forum. So it's not one that you want to miss. Don't forget to rate and subscribe wherever you get your podcasts. And if you have any questions for us, for our guests, for Joe, then please email whatthehealthtech@radarhealthcare.com. Thank you.